or sponsors.
Welcome to the Debra Tendrich Show, where we connect the dots between community, health, and business. The more change we create, the more change we inspire. So let's get this community healthy. This show is brought to you by Eat Better, Live Better, a nonprofit organization whose mission is to help prevent, reduce, and reverse childhood obesity. With over 12 million children and over 78 million adults suffering from this epidemic and poor eating habits, EBLB is dedicated to reducing those numbers and creating permanent change and a long-lasting positive impact in the community. For more information, visit eblb.org. Now sit back and enjoy the show. Good evening. We are live, the Debra Tendrich Show. Today we have Nathan Nevins and Rachel Huerta.
Hi.
We'll get back to them in a second. Again, just so you know, my name is Debra Tendrich. I am the founder of Eat Better, Live Better. If you all are just now tuning in for the first time, a little bit about me. I have a nonprofit organization that fights against childhood obesity, and I myself struggled with obesity as a child, and I became an obese adult. So I made this transformation in 2013, lost 70 pounds, and I was able to also transform my daughter, who's 8, and she's adopted a healthy lifestyle too. So now I have this huge mission and passion to make the world healthier and happier and connect the dots between community, business, and health. So today we're really going to focus on the community. And Nathan is a lawyer who actually wrote his doctoral dissertation on food deserts, which is really, really interesting because a lot of the communities I work with, they're lower income and there's not access to a lot of healthy foods. And, Rachel is actually starting a new doctor's office, which has a really, really cool, way about it where you can actually come in for unlimited visits for a small fee. The fee is different for kids to adults. We'll touch on that. Right. But I think it's really cool because she can actually relate what medical conditions are really prominent with the lack of nutritious foods in your diet.
Right.
So, Nathan, let's start with you.
How you doing?
Good. How are you?
I'm great.
What made you write your doctoral dissertation on food deserts?
Well, it's something that I went to school at the University of Florida up in Gainesville, and it was something that we saw in Gainesville, in the east part of Gainesville. It's kind of a lower income area, and they just didn't have the access that we had as students to the Publixes, the Winn-Dixies, and all that type of stuff. So just being in Gainesville really made me want to research the issue a little bit more.
So I guess you came and went to school there, and just the experience of living there made you realize the difference in where you came from versus where you had.
Yeah, but there definitely are food deserts here as well. Even though we live in a huge county, well, I'm actually from Broward. I know we're technically in Palm Beach right now, but we do have food deserts here in Broward as well. So it's not just something that affects rural populations, and that's something I'm going to talk about. It actually really affects urban populations as well, big cities. One of the statistics that I did want to mention, and I have a whole host of them, but one of the most shocking ones is that in the entire city of Detroit, Michigan, it's a city of 700,000 plus people. There's not one single major supermarket in the entire city limits. They have to rely on small grocers, convenience stores, or they have to travel into the suburbs to actually get the access to fresh food and healthy food.
What's the income line in that area?
What do you mean?
What's the average salary? Do you know?
I don't know off the top of my head, but I can tell you for a fact that the majority of the people are under the poverty line in Detroit. Like, I'm talking about the actual city of Detroit, but it's a major metropolitan area. We're talking about 700,000 people that no one has actually stepped up to the plate to offer fresh food and vegetables to them, and that has huge effects on someone's health, as I'm sure you can speak to.
Sure. Yeah, we know that nutrition is huge with medical conditions. So a lot of things that we have today, whether it's hypertension, coronary artery disease, diabetes, even some of the cancers are all influenced by our diet. So when we're not eating fresh foods, healthy foods, and we're eating processed foods instead, those foods are most likely high in sodium, high in sugars and carbohydrates, and that leads to all of these...
and all those dyes.
Exactly.
The food dyes like red 40 and yellow 5 and the hydrogenated oils.
Exactly.
In case you don't know what a hydrogenated oil is, it's good oil that when you heat it up, it turns to almost a plastic consistency. So when you eat it in the foods, it travels through your body and actually sticks to your arteries in your heart, which is, how many medical conditions are contributed to that?
Of course, yeah. And, it's interesting because the medical literature is starting to change a little bit our tune as far as fats are going, even healthy fats. We're not as much concerned about the amount of fat. So people who've been staying away from foods that have fat, like whole milk and whole yogurt, we've actually found that cholesterol is more contributed by carbohydrates. So if you think about what most people eat, and when I sit down and I do counseling for hypertension and diabetes and weight loss and all these things that are involved in primary care, because we want to prevent people from going down the road of having to take medications or having to have procedures to be able to sustain their life. When we go the preventative route and we do a lot of diet and exercise education, I'm telling them, stay away from all the carbs, stay away from the sugars that are involved in that, and shop the perimeters of the store. So those of us that have access to care and access to a grocery store, we are shopping the perimeters where we're getting our dairies, we're getting our vegetables, the foods that's not processed. It's the center of the stores that's processed.
Absolutely.
And I really agree with what you said, that an ounce of prevention is worth a pound of care. It's something I see in my legal practice as well. I represent small business owners that, they're deciding whether or not they want to do a contract, and I'm telling them it can save them thousands in the future. But, really, if you look at historically, increased weight was really in the past, like overweight was considered someone who was wealthy. And now that's just changed so much, because even people, children, adults that are overweight, they're usually not getting the right type of nutrition.
Absolutely.
So it's just changed so much throughout history, where now even those that are below the poverty line are actually overweight, which is a lot of the stuff that they eat is just empty calories. And I kind of just want to define food deserts for everyone, because I don't think everyone ever knows as much as we do about this subject.
That's a good idea.
And really what it is just an area that lacks access to affordable fruits, vegetable, whole grains, low-fat milk, and other foods that make up the full range of a healthy diet.
Not even affordable, just ones that you'd want to eat. You go into some of these stores that are in food deserts, and the apples are all rotten. The eggplant, the tomatoes are bad. You and I would never even touch it in our right mind. So why would they?
Exactly.
Why would that community even want them? So I feel this is a big deal to make more awareness and get these communities full of nutritious foods. For instance, if a single mom has 2 kids, 3 kids, no transportation, takes the bus to get to and from work, and now she has to go 8 blocks to the closest corner store because there's no grocery store. Chips are a lot lighter than meat and vegetables, so what is she going to do? Walk 8 blocks and go to the corner store where half of the fruits and vegetables are rotten anyway? She's getting canned ravioli, she's going to buy the hamburger helper, she's going to buy all these things in a box that she can cook that don't go bad and that are lighter than bags and bags of meat and vegetables. I mean, I know before I lost my weight, I always thought it was more convenient and a lot less expensive to eat like that. Now I actually eat healthy on a smaller budget than when I was eating unhealthy, and it's like you actually nickel and dime yourself to death when you're going to the fast food, when you're buying this snack and this soda and all these things. You actually spend more money, and so the education in the community is not there. Even, not to take away lower, but even the wealthier communities, you ask an adult how to read a nutritional label who makes 6 figures, they still have no idea. It's just I just wrote an article for the Parklander, and part of it is, if you require a 16-year-old to take a driver's test, because they can crash and kill someone's life, nutrition can kill you too. So nutrition should be a required course, so they don't kill themselves and wander aimlessly and drive through all these bad foods and eat them.
Well, I think that's really where practices like mine, Direct Primary Care Boca Raton, we have the time to spend with patients. The average time that most people get with their provider is 7 minutes under the current industry of insurance-based medicine. And so when you go to something like a direct primary care practice where you pay a low monthly fee for membership practice, you have unlimited access, so you can come in as many times as you need. You have accessibility with how long you need. So those nutritional counseling, that can all be a part of your general wellness and prevention. So I think like that part of it from a healthcare provider, that's our responsibility, is to help educate patients so that they know what do they need in their diet and what should they cut out.
Absolutely. I do want to let people know that they can actually call in if they do have a question to 1-888-565-1470, 888-565-1470. We'd love for you to ask myself, Nathan, or Rachel some questions. Yeah. So, Nathan, tell me,
sure.
Were you, I guess when we spoke on the phone, you also mentioned the difference a community garden would make in a neighborhood.
So there's a lot of solutions, and definitely some are national, some are regional, some are local. One of the biggest local one is a community garden. In one of the food deserts I was actually thinking of when we spoke on the phone earlier, which is right just north of downtown Fort Lauderdale, off Sistrunk Boulevard. It's a low-income neighborhood. About 5-6 years ago, they started doing some community farming, and they basically this plot of land that was essentially desolate. There was lots of crime around the area. They put a little community garden there, and the entire area has been revitalized, not just economically, but in terms of the diet of the people around. It just completely changed the area. It can increase property values, and it's really one of the easiest solutions for a local government to employ. There's a lot of other good solutions, though, that I would love to talk about, some of the stuff that I found in my research.
Well, I had a vision.
Sure.
I don't mean to cut you off.
No problem.
But, you know how all the neighborhoods have ice cream trucks? I think that they should have a vegetable truck that drives around and sells fresh fruits and vegetables out of their truck, and especially go to those lower income areas. At least if they go and circulate once a day or 4 times a week with fresh fruits and vegetables,
there's a truck called Peaches and Greens, and it's in Detroit, and they actually have capitalized on that model. It's just like an ice cream truck, just like you said. It has a song, so people know in their house when it's driving by, and they do accept EBT, which is huge for lower income areas, and it's people just walk outside, flag it down. They also go in front of churches and other community events, and I think another easy thing that cities could do is make it a lot easier in terms of the licensing for these types of businesses. As an attorney, I can see
for food
trucks, to make a special exception if you're primarily serving fresh, healthy fruits and vegetables, to make an exception in the local laws to make it easier for these vegetable and fruit food trucks to actually come together.
So what are some of the restrictions that could maybe...
Well, you need a special license. You need to pay a local tax. You need to pay a state tax. All of these things we should not be taxing these types of food trucks, but actually encouraging them. You also need special permitting to actually park in certain places.
Yes, I do know that.
So, you can get the food truck, you can pay the tax, you can get the special license, and then you might be limited as to where you can actually go. So, our local government should be
now,
encouraging these things. How does the ice cream
truck get around that? Because they just drive around?
As an attorney, not everyone does everything legally. I can confidently say that. So some people just like to play with fire, but, people that are trying to encourage healthy eating, like these people that are actually doing vegetable and fruit food trucks, we shouldn't make them take that risk.
No.
I'm curious, because vegetables and produce just in general has a shorter shelf life. So I wonder, do you think that come up in any of the research as kind of a inhibiting factor for people to do that?
So what I was able to see in my research in terms of that is that that's a huge reason as to why a lot of these smaller grocers and convenience store corner stores just don't have as much fruits and veggies, is because they simply do not have the refrigeration space. And one of the suggestions that I would love to talk about is basically grants or loans to convenience stores or small regional markets to help install more refrigeration space, because that space is some of the most coveted space in the entire market. So instead of having sodas and ice cream and stuff like that, if we could have some sort of grant or some sort of loan at a lower interest rate to encourage healthy eating in those refrigeration units, I think that would make a big difference.
Now, I really think that is actually a really good idea, but take it a step further. The government offers food stamps. And I think that they should disqualify certain foods and categories of foods from being allowed to be purchased with the food stamp card. Sodas should not be allowed to be purchased with the food stamp card, in my opinion. Chips and cookies, with certain chemicals or certain things in them should not be allowed. I just find you see these shopping carts filled with soda, chips, little Debbie snacks, and all these things, honey buns, and I'm like, wait, that money could be required to be used towards produce, or could be required to use towards, more healthier options. But then you think, if there's no access in those neighborhoods to make it mandated that they have to buy those foods, how could you put those regulations on? So in order to fix one before the other, they kind of need to be intertwined and allow those neighborhoods to have more access to healthy food, and then make a mandatory, if all the neighborhoods have a certain radius of the grocery store where they have access, then make it mandatory. But I still think soda should be disqualified no matter what.
I'm not a big government person, so I'm not ever going to be a proponent of huge legislative things that enforce everybody to do one thing. But I think it stems from kind of what you're doing. You're starting at the community level, you're educating, you're creating passion within the community, and then the community embraces it. Because I've seen in my overseas work where I've gone to health clinics around the world, is you have to address the need that the people see as a need, and then you have to work with them on what their goals are. And so I think what you're doing is perfect, because you're helping the community see the need for nutrition and exercise and better living. And to me, I see that more as the movement change that I would love to see the community embrace.
Personally, I believe that it's easier and more effective to encourage things rather than discourage them. So I think that if you were to create more options and make it easier for people to spend those food stamp dollars, and you'd have more of an effect than outright banning certain things. For instance, in some of the research I found is that not just community gardens, but also farmers markets are huge, and that there can be a lot of public-private partnerships in farmers markets to help them require the vendors to accept EBT and food stamps. And that there was a case study in Richmond, California, in a lower-income neighborhood that received all this help from the government, meaning the Department of Food and Agriculture offered expertise on the marketing, the city provided free mailers, the city provided signage and postage at bus stops. They kept the stall fees affordable at just $19 per week, and 1/3 of their total sales were from EBT food stamps. So there definitely is a model there to be copied nationwide. There's no reason for farmers markets to have this high income yuppie feel. It can be just for normal working people. And
now, is it a big process for them to be able to actually accept food stamps, or is it just an application they fill out?
It's it's a type of thing where we're small business owners, so at the end of the day, it's easier just to accept cash than even a credit card, much less going through the government. So there definitely is some red tape there, but some of it is important, as you stated. We want to make sure that these food stamps are being used for the right type of food. So there's definitely a balance there. It's not just as easy as just filling out a sheet of paper. I can tell you as a lawyer, nothing's that easy, unfortunately. But you know, it's a balance. You know, we need to.
And if it is that easy, they should call you to look over that
Exactly,
piece of paper
right.
because something's not right.
Exactly.
Yeah.
Nothing that is easy, or nothing that is worth it, is easy.
Right. One more time, if anyone wants to call in, 888-565-1470, 888-565-1470. So, okay, so tell me, Rachel, you have a new upcoming practice coming.
Yes, it's on the way.
And it's a really cool concept that I think I can sell the heck out of it because I think it's a really good idea.
Well, thank you.
So can you tell us a little bit about it?
Sure. So the concept is called direct primary care. It's a new wave of healthcare that the people around the U.S. are really embracing because they realize that we have some issues and we need to find a solution. So this is one of the many solutions that I'm sure are out there. But the idea is you can have for affordable cost, accessible care that's personalized. It's VIP care without the cost is how I like to refer to my practice. So you pay
Concierge.
Concierge. But what I'm doing is I'm stepping outside of the insurance model and I'm saying that I want to take care of my patients without the red tape, like what you're talking about. And I can do that by charging a low monthly fee that covers all of their primary care needs. So with their membership, they get unlimited office visits, as we talked about, unlimited time during those office visits, same or next day appointments, telemedicine. You know, how many times do we go to the doctor because they say they want us to come in for our lab follow-up, but we could maybe had a phone conversation about that over the phone.
But they had to come in so they can get that copay or the fee.
Yeah, unfortunately, with the insurance-based model, practices only get paid when patients come into the practice. When you have a membership-based model, you're not working under that premise anymore. So there's a lot of really great reasons to do a direct primary care practice. You can also negotiate rates, which I have done for my patients to get wholesale cost on medications, on labs,
She
on
told me
imaging.
she can get a $200 MRI.
CT scan.
CT scan, okay.
Yeah, so a lot of times the imaging centers, you know, as we talked about cash is always really good. And so I can, as a provider, I know what my patients need and I know how I can negotiate prices for them. Healthcare for primary care does not need to be inaccessible.
And you don't benefit anymore if they have 10 symptoms or one problem or 100 because you're not getting paid for 100 symptoms no matter what. You're getting paid that one fee a month. So your
Exactly.
goal is to really keep them as healthy as possible with as little treatment as possible.
Well, the idea is that they, you know, people aren't going to not come to my office because they're afraid of paying another copay or that they have a deductible. That's the idea. You know, I want people to know that I care, that they can come in as they need to come in. They can contact me all through a HIPAA secured app. They can either have an office visit, maybe they're out of town and they, you know, came up with a rash or a cold or something like that. We can
Text you the picture.
Exactly. They can text me a picture of the rash and I can say, okay, this is what we're going to do. This is my treatment plan. You know, so it is more about meeting people where they are, giving them the care that they really desire. People want to have personalized, old school, with an innovative touch to medicine. And so that's what direct primary care does. And it's simple to sign up. There's a membership that you just sign up for and it's a monthly fee. There's no long-term contract. You know, I want people to know that they like what they have. I'm not trying to, you know, keep them there if they don't think it fits for them. And another really great point to make is that with this, it covers the membership practice, but it does not cover them in the emergency settings. So people really, to cover themselves, going back to the legal side, they really need to get some sort of a high deductible or what we used to call a catastrophic plan to cover themselves in the event that there's an emergency. Yeah. But most people, what do? We go for our wellness visits or when we get sick. And so that's what the membership costs.
Yeah, and then it probably saves a lot of money because the monthly fee for insurance is way more than the $35 to $85 you charge a month, depending on age.
There's hundreds of dollars in savings with this type of plan because you're not paying the insurance company a monthly premium and then having a high deductible that you have to pay out of pocket till you reach. This model is you have a much lower premium with a much higher deductible for those emergency settings. And let's just be real, if you're going to go to the ER or be admitted to the hospital, you're going to reach that deductible. But on a month-by-month basis, your primary care needs, they can be under $100.
Yeah.
So
I agree.
The concierge model is becoming very, very popular, I will say. I mean, that's how I model my law practice.
Yeah, I prefer it more than the HMO model.
Realistically, people want that personal touch, and if you can provide it, that's huge. I know it's something I like to provide. Honestly, I've tried to copy that model in my practice, you know. my wife is actually pregnant right now. When we were searching for an OB, we saw all these concierge doctors, and I thought, you know what, you can do that for a lawyer too. So
well, congratulations on the baby.
Thank you. I made my firm, Nathan Evans Law, concierge style firm. I give my clients my cell phone number. You don't have to go through a receptionist, a secretary just to reach me. So, it really is a popular model now. People want that customer service.
Well, so now to tie in your doctor's office, the cool thing is that if you do get a nutritionally induced disease, Rachel can help you.
That's right.
So I want everyone to just shout out how people can reach you, because we have only 2 minutes left.
Sure. If they go to Direct Primary Care of Boca Raton on my Facebook page, there's a simple and easy sign-up button that they go to, and they follow the prompts. It's super easy. You can do it in a minute and fill it out.
You can go to nathannevinslaw.com or nnlaw.org, or give me a call, 954-249-3144, or just find me on Facebook, Nathan Nevins Law.
All right, and again, this is Debra Tendrich with the Debra Tendrich Show, fighting childhood obesity. I do have an end-of-summer party coming up at the Salt 7 on August 24th from 6 to 10, and I do have a jewelry line. So next week, we are going to have the jewelry piece displayed here at set, and we appreciate your support. Again, you can go to eblb.org and make a contribution or learn more about what we do. Thank you for listening to the Debra Tendrich Show, where we are connecting the dots between community, health, and business. This show is brought to you by Eat Better, Live Better, a nonprofit organization that is on a mission to help prevent, reduce, and reverse childhood obesity. Because change inspires change, the more change we create, the more change we inspire. So let's get this community healthier together. Visit eblb.org for more information. Thank you, and we look forward to having you tune in next week. Same time, same place.
The opinion